Hello, my name is Marcus Chavez and I'm with IFARA TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by James Whitney, who is with the Harvard Medical School in Boston, Massachusetts. James talks about a trial of using a TLR7 agonist in monkeys that wakes latent virus, decreases the HIV-infected cells and tissues, and when ART is stopped, it appears to result in less viral replication.
Thanks, John. So I guess one of the major motivations in the HIV cure research field, obviously other than eliminating HIV in infected patients, is looking at different modalities to try and reduce the burden of virus in patients. So one major research thrust, as I mentioned in my talk, is to try and juxtapose shock and kill or kick and kill therapies to try and reduce the viral burden. So a lot of the work that has been done historically with virus activators, they've basically repurposed a lot of oncology agents, typically HDAC inhibitors. And while these are potentially of some utility, they do carry a lot of baggage for reactivating virus in the fact that they are somewhat toxic and quite immunosuppressive. So the preclinical study that we undertook in association with Gilead, we didn't really want to go that particular route. So we opted to use something a little more direct, TLR agonist, and in particular TLR7 agonist. Now, TLR7 impinges directly on viral RNA, so it's kind of a virus-specific type of modality. And what we found, we started a 10-monkey study. The animals were infected with SIV, and we put them on a very, very suppressive regimen, also with the help of Gilead. And that regimen was critical to align our monkeys and make them very, very comparable to the types of suppression you see in clinically treated HIV-infected patients. Once those animals were suppressed, we dosed them with TLR7 agonists. And what we found was that this particular modality has a number of positive features. We get some kick, but we also get some kill in that TLRs also, first of all, they potentiate immune responses. So we enhanced overall immunity in these monkeys. And then the really novel conceptual finding was that after repeated dosing, the animals actually, upon dosing, elicit viremic blips. And that tells us that basically we're unleashing or unrestraining the latent reservoir. And the magnitude and size of these blips is much greater than we've seen with other agents, such as HDAC inhibitors. So really the important finding for us is that we have something that is really non-toxic, it's immune potentiating, and it also elicits very high level of viremic bursts. And so the outcomes that we measured, obviously we had reduced amounts of reservoir in these animals in a number of tissue compartments. And then when we stopped ARV therapy, the treated animals had a new and reduced set point in comparison to control animals. So that's essentially